Hi everyone, this is Dr. Schroeder with this week's video introduction to week number 4 of our class in the principles of healthcare research. And once again, a really good week of discussion, very spirited discussion. The focus of the discussion this week, of course, was revisiting these two articles, or these two authors at least. Beck writing about post-traumatic stress disorder in women who've experienced childbirth, and the Kolkaba study on hand massage, the comfort, the quantitative study on whether hand massage equates to increased comfort measures in a hospice population, or a very specific hospice population. And both these are pretty good studies and pretty indicative of a straight qualitative and a straight quantitative study. And a lot of opinions. A lot of you had some opinions on whether the significance was really described in both of these studies, whether the results were worth their salt, so to speak. The bottom line is that for both of these studies, although there are limitations in each of the studies, one of the limitations was not the significance to nursing. Both studies had pretty clearly delineated significance to nursing practice. Some of you, particularly with the Beck study, felt that Beck didn't really seem like she was talking to nurses. She uses the term, talks a lot about clinicians who work with this population of patient. And some of you, if you didn't feel it was exclusionary, at least you didn't feel like it was really fully inclusive of nursing or nursing values. But like a lot of research, remember that when a nursing research writes a study, it's not just for nurses' eyes necessarily. The concept is, and as a professional nurse and as a researcher, we're working on a multidisciplinary team with a variety of disciplines. Therefore, the findings that we find should be inclusive for a wider group than just nurses, which is why she used that term clinicians. This particular study and this particular population probably would most specifically relate back to a nurse midwife, or somebody working as a direct care provider, but not necessarily. It might be somebody working in mental health. It may be a case manager. It may be a nurse working in an emergency room, dealing with somebody with a panic attack. It could be any number of areas. And remember, it kind of goes back to our first week also. This is not a study where Beck is not trying to come up with a lot of answers about whys and wherefores. She's just saying, what do these women experience? That was the limitation. She left it there. Nothing else was implied. Nothing else was intended. Now, some of you felt that seemed like it was a weakness. Why not take it farther? And the reason is because just like with almost any process that takes certain steps, sometimes you sort of sit back, look back, see what we have, then we move forward again. Important concept. Remember that a nursing research study is not meant in and of itself to necessarily prove anything. Research is just meant to generate new knowledge or to answer specific research questions. It is not meant to be at least most studies, with very few exceptions, are not meant to be, this is it, this is the proof, we found the answer, we don't need to talk about that anymore. Instead, it's like, hey, I found some information, what did you find? And so the nursing community, the nursing research community, and other disciplines would look at the same information and say, gee whiz, I wonder if we would come up with the same information. Or look at what Kolkaba found, look what Beck found. Let's see if we can identify some new studies. Maybe we can do some studies where we start to ask, what are the what are the causes of post-traumatic stress? What are some of the correlated factors? What are some of the reasons, why? And that takes qualitative methodology. So that would be the next step, maybe doing a mixed methods or a quantitative study on some of those pieces of knowledge that Beck identified. And with the Kolkaba study, we're kind of at the other end of the spectrum. Very narrow study, very narrow population, not meant to prove a lot in and of itself, other than for this population of patients who are dying, particularly this, um, this rather, elderly population and people who were at the last stages of life, a hand massage, a simple hand massage, did not significantly increase comfort. Nothing that you can say was significantly significant. Now, that doesn't mean it's a bad study. That doesn't mean it was poorly done. That doesn't mean that it should have never been done. I mean, why waste their time on doing the study? The idea is that they didn't really know. It is significant information, even though that there was no significance found. Just the fact that there's no significance. A few of you pointed out that just doesn't sound right. So you're exactly right. That's why it takes in going and redoing the study, redoing it with another population, and not so much trying to prove that hand massage feels good or improves comfort, but rather for this population of patients, is it something that we want to invest time and effort in training CNAs to do? Because it will help to increase quality of life. That's really sort of the bottom line here. And then the next logical studies would include doing the same study with a larger population, with maybe a little bit of a different population, maybe with a different diagnosis. There's any number of ways that, or maybe with a hand massage over a long period of time, a hand massage with other adjunctive therapies. But the idea is that it's a piece of information that then becomes part of the nursing literature. And also, because this is a population that we all deal with, I think we can all relate to that. There's true significance here. And the significance was fairly well documented and pretty straightforward. So anyway, once again, a very good week of discussion. And this week we're going to switch topics a little bit, and we're going to start talking about validity and the ideas of external and internal validity. How do we measure validity? And remember, there's differences between confidence levels, validity, and error. And so I'm not going to lecture on that right here. I'll leave you to your reading to sort of examine some of these topics. But we're going to be talking about how do researchers ensure validity? How do we make sure that our results are valid results? In other words, how do we know that they actually measure what they purport to measure, the different measurement tools that we come up with? And that will be the topic this week. Of course, also remember, starting on Wednesday at midnight, your midterm exam comes open. It will stay open through Sunday night at midnight. So between Monday and Sunday, remember, you got to go in and start it to finish it before it shuts off at midnight on Sunday night. So, and those times are all Eastern time, so just be aware of that. And multiple choice test, if you have any questions, please let me know. You'll know your results from that test right after you take it. So, once again, I look forward to a excellent week of discussion with you. I look forward to seeing you in class. Look for your discussion questions grading sometime midweek, and I shall see you in the discussion forums.